Hello, it's Dr. Gee again with the new updated coronavirus What to Do. So we're going to talk about how you can desensitize or rebalance yourself, your immune system, your neuroimmune system in the presence of the virus. Now fortunately this system works for any virus, and it's helpful even for allergies or other issues, so you don't just have to wonder if you have the coronavirus before you do it. But if you think you might have it, it's proving to be helpful already. So first of all, there are three necessary components for a successful rebalancing of the neuroimmune system. The purpose of rebalancing your neuroimmune system is to help your natural immunity fight the virus and deal with it. A virus is like a very clever criminal. For instance, if a clever criminal wants to rob a bank, he might call in several false alarms for fires somewhere else, and all the first responders will rush off in the wrong direction, and then he will rob the bank. And that's what the virus does to our immune system at several steps along the way in its progress of trying to replicate and take over your body. The virus distracts or misdirects your immune system, and that's what makes you very sick. So rebalancing your body helps you get over it quicker, moves you right into all of the proper immune phases so that you can kick it quickly and easily. Won't necessarily keep you from getting sick. Presumably if you're doing this, you're already perhaps wondering if you're sick, but it will help your body treat it properly and help you recover. So I hope you find this helpful. So the three things that we need are, don't judge me, our audio visuals are pretty improvised, okay? So first we need an offender, then we need a location, and then we need the maneuver. Okay, and we will post a picture of this down below this video. So for our offender, we're going to use the saliva or mucus of the patient. Now the patient can be someone you're working on, or it can be you yourself. So we're faking this because this is our fake sick person, okay? So Sarah would actually produce a big wad of saliva, blah, 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 blah. Okay, and you will, in a very sanitary fashion, fold it up. When I'm working on other people, I always have them put it in the plastic bag. If you are making an offender for yourself, it has to leave your body briefly. You just get it out of your biofield, and then you bring it back in, and at that point your body knows that there's bad germs in there. Okay, so let me show you how this works. If we have now you don't have to do any muscle testing at home. I'm only doing muscle testing to demonstrate the effect, so it makes more sense. You don't have to do that part at home. Okay, so here's a strong muscle. Hold. I'll handle making them weak. Okay, just do your normal thing. Okay, now here's the offender. We've taken it out of her biofield. Now we're putting it back in. Hold. Okay, and her body doesn't like it, and we know there's a problem. So we start looking at areas where the problem is localized. Okay, hold. When I have the offender inner field and I clue into her sinuses, which is where the offender entered, then her muscle strengthens up, and that tells me that I'm in the right area. Now, that's not what you're going to do at home. I just wanted to explain it because it makes a sort of intuitive sense when you're trying to wrap your head around what am I doing, why am I doing it, okay? So here's what you do at home. You get that offender, you put it in their field. The next thing we need is the location, which we started here, and we're going to check, we're going to treat a lot of locations because viruses don't stay here, they work their way down and cause problems. And the third thing we need is the maneuver. We actually have two maneuvers. If the location is mid-neck or above, then the maneuver that we're going to do is a slight gentle traction on the neck. I'm just pulling a little bit upward, and don't be rough on this, especially on an older person. You just need a little pressure. It should feel good. And if Sarah's head was a ball, I would be rolling it forward a little. That's it. This neuromuscular action rebalances the body. However, I left out one thing. I didn't stimulate my location. Okay, so here we go. Now we're going to start the treatment, and I'll just talk as I do it. Offender, location, maneuver. Okay? This area has been rebalanced in the presence of the virus. Now, let's say she already has a headache and is sore, maybe her bones ache. Anywhere she hurts in her head, you can rub and bring the body's attention to it. You have just a few seconds to do maneuver, and that area has been rebalanced. If she has pain at the back of the neck, can you get in close here, Mary? Many times the back of the neck gets very, very painful. You can just dig gently in there, bring the body's attention to it, and do the maneuver. Okay, now this is very important. As we work our way down, we're going to get under the chin and do the maneuver. Now right here, this area, the sinuses and the lung areas are the most important areas for a virus typically like this because you breathed it in. So we're going to get in there and just gently really get detailed. I'm feeling cartilages here. I'm not pushing hard. Don't be rough, okay? You don't need to, and it wouldn't be safe. But you may feel little lymph glands. You want to get around them. Anywhere that's especially sore is very important to do the maneuver, okay? If you just rub it and don't do the maneuver, it's not going to work, okay? Nice little lymph flush, but it isn't going to work for our purposes. Get on that sore throat. Work your way down. See how gently I'm doing that, but I'm kind of getting in there. I can feel things. And I'm going to do that. And since we're below mid-neck, I am now going to do a different maneuver as I get lower. I'm going to reach down and flex the feet like this. Okay, all this is I have to lengthen this area right here. And for me, the easiest way to do that is to flip the feet. Now, if you're doing this to yourself, you can flip your feet yourself. It's easy. Sarah, flip your feet. Both of them. Great, okay. So, as I get in here, here's an area, the thymus. It's a very crucial part of your immune system. I stimulate it. Sarah flips her feet. This area has been rebalanced. Now, as I work all the way down the sternum, there's a breastbone here, and I can just work it and flip your feet. I like to do the flipping myself because I'm the doctor. So, but you can do this yourself, okay? I'm working in, and often you'll find areas that are sore, and the person will tell you, or you'll feel it on yourself. Now, off to the sides, you'll feel ribs and spaces between the ribs, and especially you'll see some that are very, very sore if the person has something going on in their lungs. Just give them that little rub and flip the feet. Move on down. Get that whole area and flip the feet. Okay? Now, with a guy, it's not a problem. With a woman, you might have to kind of maneuver around a little, but there's a lot of rib areas in here that are very helpful to work with, and if they're sore especially. Here's an area you don't want to miss. This has to do with lymphatic drainage. See, it's kind of under the armpit. You get in there and you find little sore spaces, the ribs and the spaces between the ribs. Flip the feet. Our fender fell off, but it's still close to her. It's fine. So we'll just put it on there so we don't forget it. Remember, if this wasn't here, I'd just be giving her, kind of a mediocre massage. Okay? If this is on her and I do the offender, the location, and the maneuver, then I have rebalanced her body. So now I'm going to go over to this side. This is the spleen area. Spleen is very important in immunity, and the coronavirus particularly attacks the spleen as well as the lungs and lymph. So we don't want to forget that part. And then when I come down here, this is where the ribs end. And there's some always, I call this the horseshoe, the toxic horseshoe. It's like an upside down horseshoe here, and it's always sore. And it will be particularly sore if the person is sick. And you can find, you can be real detailed and work your way in, or you can just kind of generally hit it. It's going to work well one way or the other. Okay, this is the general respiratory area, and can I show your belly button?
Mm-hmm.
You sure? Oh, Sarah's such a sport. She's a good sport. Okay, here's your belly button. Okay. I want you to treat the adrenal points for sure. Here's your belly button. I'm going to go up about 2 inches and out about 2 inches, and right in there, they're going to be sore. So just rub them a little bit and flip the feet. And the reason you have to treat the adrenal glands is because they are dealing with the shock and the stress of having a virus. The other place for the adrenal glands is in the back. If you run your hand back here, kind of at the bottom of the ribs, and towards the spine, you're gonna feel around there, and as soon as they wince and go out, you'll know you've hit the spot. You're just gonna get in there and work them like this, and then flip the feet. So you balance the adrenals, and you probably balance the kidneys at the same time. Okay, now, a certain percentage of people that have the virus are getting nausea, possibly vomiting, or even diarrhea. The diarrhea is becoming a little more common, I've noticed. So we're going to do more. This area right here, here's your pubic bone right there, right above it, kind of soft lower part of the belly, is a great place to stimulate for the colon, the bladder, and so on. Stimulate it, flip the feet. Okay. You've already done the stomach if you're up here. You can also rub anywhere that's sore in the stomach. I mean, a lot of times I'll spend quite a bit of time around the belly button, and I just look for sore spots, but you just have to go on your own skill set at this point. So this area here is particularly a reflex area for the colon. So if there's diarrhea, you want to get in, you can just rub it generally like that. Flip that foot. Coming over to the other side. Basically doing the same thing. If you find any really sore points, you can get in there a little more specifically. Okay, so that's the general thing. It's very helpful. We've had great feedback so far. I'm extremely happy and gratified that people are, we've already been told that fevers drop and pain goes away and people start improving. You should know that as the virus works its way through its system, you're going to have to do this more than once as you're treating a patient. And every time you do it, you should get a new offender because your body is changing. So after the first one, maybe you're going to treat the person the next day, or you're going to treat yourself the next day. You're going to toss the first offender, make yourself another offender. Many of you will probably be doing this to yourselves. So let's just say I'm kind of laying in bed. Okay, I've got my offender because I just sneezed into a Kleenex or something. There it is. And the main thing I want to do is to get this area. So start with those sinuses. That's your location. You've got your offender, your location, and then you're going to do the maneuver, right? I kind of use my hand to help myself. I'm going to show you from the front, the side, and the back. Watch this. Here's how I do the maneuver from the side. You want to notice the stretch right there. So you can just feel. That's all you need. It's not it's just a nice little stretch there, right after you've done the location. Here's how it looks from the back, right? It's just, okay? I hope that's clear and helps you. So as much as I'm working on bones, cheeks, and around the ears, under here, there, anywhere you can sense any sore throat, just work on it for several seconds and then do the maneuver and then continue. Get in, especially all here, just go in for the detail, because this is where the germs are hiding. If you have sore bones in your head, your sinuses, go right and just rub them a little and treat them, and that's going to rebalance. You'll feel that soreness drop noticeably if you're paying attention, and it's going to help your body move on to the next task of going after that virus. Another thing you can do is get in the back of the neck back here. You know, these areas frequently get very sore. If you get down to here or lower, remember, you're not doing this maneuver anymore. You're doing the foot flip, right? Because you want to lengthen that area there. Neurologically, that's going to reset your neuroimmune system. I'm not going to get into the details now. It doesn't matter. What you want to do is you do this. You can do this on your kids. You can do this on yourself, your spouse, your friend, social distancing, but it's very helpful. Don't be afraid to try it. You can't really do it wrong, because if you sort of do the wrong place or the wrong thing, your body just ignores it. But if you do it right, it's going to rebalance you. Okay, look in the links below. Thanks.